Hi, thank you so much for clicking on this video. If you are new here, my name is Aminata. I am a nurse practitioner. And if you're a returning viewer, thank you so much for coming back. I appreciate your help and your support. And working as a outpatient nurse practitioner, I wanted to that focuses on mental health. I wanted to come on here today and talk to you guys about what are some things to expect if it's your first time going in to go see a mental health provider. And this is focusing more on the prescribing aspect of it, not so much on therapy, because I don't really do therapy. And I'm more focused on the prescription aspect of it. Although a lot of the times I spend so much time talking to my patients, more like developing a therapeutic relationship and talk about therapy related topics, that sometimes it may feel like we are doing therapy or patients are there for therapy. And I lie to you not, I've had so many patients where they come to see me and I will say, oh, hi, my name is Aminata. My role is medication management, which means that I prescribe medications. And we go through the whole visit. And then at the end, they're like, oh, this is not therapy. I was like, oh, I must be really good then. That this feels like therapy, because that's what you want it to be. And it's amazing how you have so many people that feel comfortable going to go see other providers, such as the primary care providers. But when it comes to their mental health, they just get so nervous. So I hope this video is able to help you feel a little bit more comfortable and get an idea of what are some things to expect. What is it like going in to go see a mental health provider for the first time? So again, I work outpatient psychiatry as a nurse practitioner, and usually for your first initial evaluation or your first visit, what we usually have you do is fill out some paperwork that gives us an overview picture of what's going on with you, your physical health, your mental health, some family history questions, questions about medications and things like that. So I usually look over those paperwork. And then what usually happens is when I'm meeting you for the first time, whether it's through Zoom, which is what we're doing nowadays because of the COVID situation, or when I used to see patients in person in the office, is I will usually ask them, what prompted this visit today? And that gives you a better perspective from the patient themselves. Why do they feel as though they needed to schedule this visit? What is the reason for this visit today? And some of the time that reason changes, especially when you see what they wrote on that paper, what the reason, because they ask them that on the paperwork as well. And also when I'm asking them, sometimes it changes a little bit. And I think it depends on, maybe things change with them as well. Maybe before they feel as though their main problem was anxiety, for example, and by the time they visit with you, they focus more so on depression. So it depends on what they feel as though is the main reason at that particular moment, and I usually go from that. And how I usually go about tailoring the appointment is I go by system. So I start off first with asking questions about medications, because again, because I prescribe medications, it's kind of the first point that I kind of hit on is what medications that you currently take. So, and that doesn't just include mental health medications like antidepressants. I also ask about other medications that they currently take, because some medications may interact with others. So I usually have a list of all of the medications that they currently take, the active medication list. And I will usually ask questions about medications that they used to take in the past. And in that aspect of it, I just focus on mental health medications. And usually I'll ask about what happened with that medicine, if they're able to remember, and did they have a bad reaction to it? So at least I know not to repeat that medicine again. And sometimes for some patients that if they've been on so many different medications, I usually try to, and they can't recall what happened, I will request for records from their previous providers, because sometimes it may mean that if they say the medicine didn't work, they might have been on a really low dose. And they might not have utilized that medicine. So, or sometimes it gives me an overview picture of when they took it, what happened, because sometimes it's a lot to keep track of all the meds that you've tried, what happened. And you have some patients that have been diagnosed at an early age and they've tried so many different medications that it's hard to keep track of what they've taken. There's been days where I can't even remember what I ate yesterday, to be honest with you. So I know that can be really tough when it comes with medication. So that's what I usually start off with. And then I move on to any past medical history. So I ask about any heart problems, lung problems, seizures, any major health issues that they're currently doctoring for, or they have seen a provider for in the past. Again, some of the medications that we use, affect different body system, heart, lungs, and things like that, that we want to make sure that we know a good history about this patient, about their physical health. And then I go about asking about any allergies to any medications. You really want to know if your patient is allergic to certain medications, especially if it's a mental health medication, so you don't prescribe that. And then I go on to asking about, sometimes I'll touch on immunization a little bit in terms of, are the immunization active? And then sometimes some patients will tell you why the immunizations are not active. And I go on to family history. So that's really big. So family history, some of the major things that I usually focus on, one of it is mental health, but I also ask questions about things like substance use issues in the family. I ask about heart problems in the family, high blood pressure. I ask about cholesterol issues. I ask about obesity. I ask about thyroid issues. So pretty much a lot of the things that either the medication that we prescribe has the potential to influence certain things, or for example, if you have a huge family history of obesity or excessive weight gain, and some of the medications that we prescribe tend to make people eat a little bit more, which means they're more likely to gain weight. So if I have someone that's already struggling with that, there's some medicine that are a little bit more weight friendly, and there's some that are not so much. I usually try to avoid the ones that are not so weight friendly, especially in someone that has a significant family history of weight gain or obesity, and maybe they themselves are already struggling with weight also. So that kind of, again, is to get an overview picture of what's going on. That's going to help you come up with a better plan. So that's pretty much some of the questions about family history. I also usually ask about suicide in the family, either attempt or success, succeeded suicide. So those are some things that I usually ask about. And then I move on to personal questions about the patient. So that this involve substance abuse history, alcohol, any type of drugs, marijuana use. Because sometimes people don't think that substance use, especially with how common marijuana is nowadays. So I ask about that. With all of my patient visit, especially initial evaluation. I ask about, do you smoke cigarette? Do you drink alcohol? How much of it do you drink? What kind of beverage that you drink? I ask about coffee and intake. And it's amazing how sometimes nowadays it's almost weird if I ask a patient and I say, do you drink coffee? And they said no. I almost don't know. I feel like it's a little odd because almost everyone drinks coffee, and depending on how much coffee you drink, sometimes that affects your anxiety levels and things like that, and your sleep. So a lot of the times I'll ask questions about that. And then I also usually ask about any previous traumas, so sexual, physical abuse, different type of abuse. I'll ask about that, and I'll also ask about major surgeries, for example, especially with gastric bypass. We have, when someone has had gastric bypass, most of the medications that we take, especially in the pill form, they have to pass through your stomach and all that stuff, and absorption wise. So a lot of the times you want to ask about those history, or patients that struggle, that have had multiple surgeries that may be related to why they're having chronic pain now. So those are some things that I ask about. And then I move on to the next step is, depending on what you stated on your paperwork, and also when I ask you about what things that you struggle with and what prompted this visit, is how I go about gearing my questions. So if you said your main issue is anxiety, for example, and depression, or sometimes some patients would just think it's just anxiety, but a lot of the symptoms that you find in anxiety, you also find them in depression. And a lot of the time, anxiety and depression go hand in hand. So most of the time, if someone has anxiety, I'll also assess for depression. So it just depends on there's some mental health issues that kind of go hand in hand with other diagnoses. So I usually will pull up a questionnaire based on what they think their problem is. And sometimes even if they don't mention it, depending on how the conversation is going, there are some questionnaire that might pull up, for example, with PTSD. Some patients don't realize they have PTSD until you start asking them questions about PTSD. That's when you come up with the diagnosis, like, okay, they do have PTSD going on and stuff. So again, for example, with questions for anxiety, I usually ask about some of the common symptoms of anxiety, such as difficulty concentrating, excessive worrying, problems with irritability, problems with avoiding social situations, problems with feeling restlessness, problems with sleeping, problems with feeling on edge to the point where you've canceled plans with friends, or you've called out from work because of anxiety. So these are usually questions that I ask about. And then we go on to, when did you first notice anxiety? So the onset of when you first notice whatever the problem is, and then I go about asking questions about how often do you feel anxious? Is it every single day? Is it situational? And then I go about asking, another question would be, what are some things that you notice that sparks your anxiety? So some things that you notice, every time this happens, my anxiety is sky high and things like that. And then what do you usually do? What helps you? And then I usually ask questions about, in your own terms, how do you feel as though your anxiety is, or whatever problem that you're struggling with. So I usually use things such as mild means it's not a problem, which a lot of the time if someone is visiting with psychiatry means that it's a problem, which the symptoms are usually categorized that as moderate. So it's a problem, or severe, which means that things are out of control. So those are usually ways I go about gauging how they describe their symptoms and where do they feel as though they are in that moment. And that also drives treatment. So if someone is telling you that my anxiety or whatever thing they're seeing you for, it's not really a problem, so and things are manageable, usually we don't change anything. And you do have some patients where they are already on medications, or some of them are not even on medication, they just want to establish care, and some of them just wants to have certain diagnosis to make sure they don't feel as though they are quote unquote going crazy, or they feel as though there's something wrong, that they just need an explanation to why they're having certain behaviors. And some people sometimes don't want any treatment, they just want the diagnosis, and then you follow up and then kind of continue to visit with them and see how things are going until they get to the point where they feel as, okay, I think I'm ready to start medication. So after we've gone over all the questions, we come up with a diagnosis based on the symptoms that you're having when they started and how you're currently feeling. Then we go about coming up with a plan. And the plan usually entails, for example, again with anxiety, let's say if you're seeing me for the first time and you're already taking an antidepressant such as Zoloft, I ask, how are you tolerating the medication? Which means that, are you having any bad side effects from the medicine? And I would have already known the dose that you're on. So that way I go about deciding, okay, so you're already on that anxiety and depression medicine. The dose that you're on, it's on the lower end of the dose, and you're tolerating medication. So usually my next step would be, let's go up on your dose. So a dose that, an increment that's appropriate depending on the drug. So that's usually how I go about creating a plan. And I usually ask the patient, do you have any questions or concerns about the plan that we come up with? So we're gonna go up on your medicine, and depending on, again, severity of the symptoms and what medication that I'm starting them on, usually I would say, let's follow up in 1 week. Because some medications work faster. For example, such as benzodiazepines like lorazepam, clonazepam, Xanax, and stuff like that usually works faster. And if you have someone that's having severe symptoms of anxiety and you start a medication and you know it's going to work a little bit faster, and usually you're able to follow up again within a week. And then there's some medications where I say, well, let's follow up in 2 weeks. And I always tell my patients that if for some reason, and this has happened funny enough a lot more, even after I tell them that if anything happened where you need to see me, please don't wait until a week or until the time that we're scheduled to see each other. Call the office and we can get you in to see either myself or a different provider. Because sometimes patients would try to toughen it up and say, well, I figure I had an appointment coming up in a week, even though their mood is worse or something happened. They will wait until the next appointment, and then they will tell you about how things are going. So I've always been very good at telling my patients that if anything is happening, you have any concerns or anything after we visited, please make sure you call. And I also go on and talking about side effects of medications, what to expect. And I'm very clear about telling them for some of the medicine that we use in mental health, they don't work right away. It takes time to build up in your system for you to start seeing an improvement. So I'm usually very good at making sure my patients know, so they don't go home and they're taking an anxiety and depression medicine, and it's like 2 days later and they're like, I'm still not feeling good, my symptoms are not better. But if they already know that it takes time, they're a little bit more patient. So that's kind of pretty much an overview picture of what to expect on your first visit with a mental health provider, focusing on more on the medication aspect of it. So again, it's usually pretty laid back, and I think as a provider, a lot of the time your personality makes people feel more comfortable talking to you. And for me, it's always amazing how when you see patients visit you the first time, they get so anxious, and as time goes on, the anxiety just decreases. And a lot of the times I'm able to throw in jokes where they can laugh, because it's like they're already going through so much, feeling anxious and worrying and different type of issues that they're struggling with, that the last thing I want to do is make things difficult for them for that visit. So anything that I can do to make the visit a little bit lighter, that's usually my goal. So that's pretty much an overview of what to expect, and a summary of what to expect during your first meeting with a mental health provider when you're talking about medication wise. And I know a lot of people do different things depending on the providers. That's just a summary. There's much more that comes with that as well, but that's kind of an overview, a summary of what to expect. So guys, it's really not that bad, I promise you. You are gonna be fine, okay? And it's okay to be nervous because you're meeting someone for the first time. And a lot of the time, again, when you're coming to talk to a mental health provider, sometimes some people have to talk about some traumas that they've been avoiding for a long time, and it's just very uncomfortable. And I get it, to be honest with you. I do get it. I'm one of those people that's very private. They'll like to talk about things much, and I promise you it gets better once you meet with that provider and it's the right provider for you. Then you're able to feel more comfortable talking to that person, and it doesn't feel like such a burden, and you're actually able to get the help that you need. So I hope this video was helpful. Make sure you like this video, comment down below and let me know, guys, if you are thinking about, you have been thinking about going to go see a mental health provider, and what is the reason why you haven't, okay? Please do comment down below, okay? And if you've had different experiences with different providers, that's the reason why, comment down below as well, because things are always a little bit different for different people, depend on your personality and how different providers do different things. So I hope this video was helpful. Until next time, take care, guys, and you guys have a great day. Stay safe, be positive to one another, and until next time, bye, guys.